in your nutrients. And it's one great big complex conveyor system. So many people ask me about diarrhea and constipation. Diarrhea is when you basically, the conveyor belt's going too fast and you're dumping things. And with my patient today, he's like, hey, I go to the bathroom, or excuse me, I eat and then I'm immediately into the bathroom. One of our patients on our testimonial page, Trevor, was going to the bathroom like 40 times a day. He was running a business literally from the team bathroom at his workplace. It was his business. And he's like, man, I can't even, I'm just sitting there going to the bathroom. And the way that you help people is to try and figure out, okay, what is the trigger for the dumping syndrome? I like to just start it off really easy with digestive enzymes. That's number one. Then we like to help people to heal and soothe irritated GI tissue by using fat-soluble vitamins, vitamin A, D, E, F, and K. Sometimes people say, I don't even know if I believe that there's a vitamin F. It's also known as bioflavonoids. Just some old school terminology. It was known as vitamin F back in the 20s and 30s, and it just kind of stuck in our office. So my grandfather taught my dad, and my dad taught me, and it just, anyway, stuck. But bioflavonoids are your colorful things in your diet. And then the last part of your GI system, the colon, is where you absorb vitamins and nutrients. So if people are struggling with vitamin loads and stuff, it's usually because they have a diseased colon. So depending on where your problem is, the top part of the stomach, the middle part, or the last part is how you can help people. And so that's really important. You are what you eat, and you are what you absorb. So just kind of a quick recap, if people are joining us on Dr. West Live, we are moving our live a little bit earlier. We want to do it around 5 o'clock on Thursdays, not 7. Obviously, with our worldwide audience, sometimes people are like, it's just too late for us to participate in, so we're going to move that up. But this segment, we're doing question and answer period. Last week, we had a whole bunch of stuff. I think we answered over 30 questions of people that were bringing stuff in. And so if you're on this and you want a specific health question answered, then you should talk to me. So, hey, my friend Stephanie Bowen in Washington runs some really good pizza place up there. So, Stephanie, here is your note. What do we do if the government requires a mandatory vaccine? And I really feel you. This is so concerning to me. I read an article about COVID-19 that said the virus that killed the Constitution. And I certainly, at this stage, I am not wanting to do that personally. Now, I have nothing, I have nothing opposed if people want to get a vaccine. Hey, I'm all for it. But when it comes to whether I would want or not, at this stage, I'm not convinced that it's the thing that we should be doing at this stage. There needs to be, testing, and there needs to be and just at my core onset, I've seen a lot of complications associated with vaccines. I always have patients in the office that have complication with vaccines, and Stephanie, I'm not going to do that. That's for me, and I'm certainly wanting to educate people on all of their options, and then they need to make the right decisions for them. But I hope that I can't imagine it being mandatory. Like what happened to my civil rights? What happened to my constitutional rights? Anyway, and so we just got to figure this out. If they make it mandatory, like I can't imagine making it mandatory on something that is less problematic than heart disease and cancer and accidents and stuff like that. And we're not mandating that we go 4 miles an hour, we ban cars or anything like that. So Stephanie, let's keep our fingers crossed that it's optional. A lot of states are moving towards. I know that California they have lost some of the ability to choose their healthcare interventions. At least in my state, I have the option of a religious, a philosophical, or a medical exemption, and I'm just not convinced that putting this COVID-19 vaccine, if there even is one, like you're hearing about the trials and stuff like that, I'm not even sure if the research would support it at this stage. So anyway, let's see how that pans out. Okay, Tina Say says, hi, Dr. West. Hi, Tina. I hope you're doing well. You're healthy and safe in that area, which makes me go to one of the things that the Tina shout out makes me think of is hormone balance. And so I had another patient that came in this morning and was talking about, hey, how can I get healthier? And they get healthier with hormones. I don't like to recommend or suggest prescription hormones. I mean, as a alternative medicine provider, I turn that over to our medical director to do it. And here's what I want to help people to do, and that is to give hormone precursors or building blocks so that people can make their own hormones instead of getting them in from the outside. We do that by a special nutritional therapy called proteomorphogen therapy. It's the smallest unit of cellular blueprint assembly. When you don't have enough proteomorphogen in the body, the cells become senile, they de-differentiate, and they die. There's a specific way to feed organs and glands and stuff like that through glandular nutrition, and that's what we like to do with hormone imbalances. Now, about this stage, everybody's saying, hey, Dr. West, what are you doing about the coronavirus and the updates? So the first thing that I'm excited to tell you about is for our patient population and stuff, we have had some really good health success stories. I'm in an area that has not been dramatically affected by the coronavirus. We have been affected by the coronavirus shelter in place and the coronavirus panic. There's been a lot of stress. I'm feeling the stress. I like to tell people, hey, the coronavirus, I didn't get sick. It just gave me a kidney stone because I didn't practice what I preach, was getting enough water and sleep. I've been worried about patients. I've been worried about the team at the office. I've been worried about the impact that it's having in my community and my country. And anyway, I didn't drink enough water, and oh man, those things are miserable. So not sick from the coronavirus. Yes, sick from the stress from the coronavirus panic. Luckily, there's a really cool way to take care of that by using phosphorus, which is a mineral that helps to dissolve abnormal calcium deposits, tomato juice, and sauerkraut. A big shout out to Cora at the office who helped me put together this concoction of, I mean, it tasted so bad, I just knew that it was going to clean out the kidney stone. That being said, a real quick comment on kidney stones is there's two types of kidney stones. There's calcium and there's uric acid. Uric acid is basically when you have too much, you're not breaking down protein correctly, and the uric acid settles out in the kidneys. And then calcium is when you don't have enough acid in the system. So you want one you want to alkalize, the other one that you want to acidify. And so usually when you correct physiology, you can make kidney stones go away. I've got a really neat kidney stone testimonial up here on our website. It's on the daily dose of vitamin H. I'm so excited to share this with people because I have hundreds of testimonials on Lyme disease, I'm not going to die, wheelchair to walking, people from Louisiana. Jenny came from Louisiana, and Emily comes from the other side of the state, worked with our medical director. It's just fun to show people that we have some really good outcomes associated with common clinical conditions just like you. Now, my friend Robert Harmon, all the way from the booming megatropolis of Wyoming, says, hey, my wife has some really sore joints. What do you suggest? Well, when it comes to sore joints and what you can do at home, there's a couple things that I'd like to try with that. So the first thing that we want to do is we want to have, let me get back to the bigger screen here. Water is the number one thing that I tell people, like, let's get a lot of water in your system. The other thing that's really helpful with that, high doses of vitamin D, about 10,000, sometimes 20,000 units are really good. I like oral apple cider vinegar. Works really well for joint problems at home. And then proteolytic enzymes and essential fatty acids. So what does that mean? That means taking a fish oil, flaxseed oil, evening primrose oil, GLA, and do about 5,000 to 6,000 milligrams of essential fatty acids. And you want to combine it with a proteolytic enzyme. So a proteolytic enzyme is an enzyme that helps to break down protein. So natural sources of that are papaya and pineapples. Raw cherries are a really good source. You can get this in health food stores, or I can get it from me in the office. A proteolytic enzyme mixed with essential fatty acid literally can give you some dramatic pain relief, like aspirin or Tylenol, without the kidney and liver side effects. So essential fatty acid, about 5,000 to 6,000 milligrams. Usually a pill is 1,000 milligrams. So you're about 2 pills 3 times a day of essential fatty acids and 1 proteolytic enzyme. It works best if you take the proteolytic enzyme on an empty stomach, because it's like little Pac-Man in the body there, chewing up inflammation. Whoa, I ripped out my headphone. We're chewing up inflammation. And so, Robert, for Julie, I'd really like to remind you guys, water, essential fatty. Oh, the other thing, about a tablespoon of apple cider vinegar is really good in half a glass of water. It helps to basically get rid of inflammation. I don't like that concoction. I have to be honest. I'd rather take the essential fatty acid and proteolytic enzyme, but apple cider vinegar, a tablespoon, half a glass of water 3 times a day. Another consideration is the Joint Revive that we have in the office, or we sell through Nature's NX. It has the proteolytic enzyme, it has some collagenase, it has some shock absorber in it. I like glucosamine and chondroitin sulfate. You just have to be a patient and consistent, because it'll help. It just usually takes a while. It's not fast acting like aspirin. And then the other thing, Robert and Julie, try some Epsom salt baths. Warm water, 2 cups of Epsom salts. You can get that from basically any grocery store. I've seen had really good outcomes with that. And so anyway, and then avoid inflammatory foods, sugar and grains. And you don't have to be celiac sensitive to get rid of grains, to see the benefit of having no grains in your diet. I see a lot of really good responses with people that have arthritis doing a arthritis field diet. Okay, Sari on YouTube, thanks for checking in with this, says, is it possible to heal from autism and frequency seizures? Well, what a great question with a whole bunch of answers. My brother's 24, and 3 years ago he started having symptoms. He also has severe anxiety and depression. So, Sari, on the question that you have, if you go to our, I got to get the website up here. If you go to our website here, dailydosevitaminh.com, I have a story of Corinne on here who had seizures for about, 50 years. The seizures are not gone. They are dramatically reduced. And so what we did for Corinne is we were able to help her with rewiring the nervous system, which is using something called neural therapy. It's a treatment that we do, and it gets the nerve endings to open, close, and reboot. You also want to really help the nerves to be healthy. I like a proteomorphogen therapy called neurotrophin. It gives you building blocks to have healthy nerves, high dose essential fatty acids, and then you want to see, is there any type of infection that could be a factor? And when we talk about infection, you want to rule out Lyme disease, you want to rule out human herpes simplex 1, 6, 7, cytomegalovirus, parvovirus. Some of these chronic infections, according to the British Journal of Medical Practitioners, can cause neurodegenerative, neurobehavior, psychiatric, autoimmune, and fatiguing illness. It's a study that I love to share with people. If you'll hashtag autism in the study, and I apologize, I'm recognizing you asked about autism, and I already immediately went to with Corinne, and it was talking about epilepsy. I'm sorry, I got to get back on track. Autism. There's a whole bunch of hypotheses and stuff of why it can be a factor or why it bothers people. And so one of the things that I'd like to tell people is if you detox the body out of the heavy metals, I think that there can be a vaccine trigger. And I know this is controversial. It's just my clinical experience based upon my opinion that I've seen some good outcomes with that. My dad taught me a protocol that's pretty good for autism. We've had some really good outcomes with seizures, regulating neurotransmitters, nutritionally supporting the nervous system. And anyway, I just need to have a conversation with you to see if I can help with the neurotransmitter balance that's causing the anxiety and depression. Usually it's a teeter-totter. You have one another at different times of the day. And anyway, I think that I can help with that. Sari, I'd love to talk to you more about that. Can you reach out through either YouTube or Facebook Messenger and just do a hashtag that says autism, and I'll come back and pick you up and we'll figure out how we can get you some help there. Okay, the other questions that we were talking about is stomach. We went through a real quick review. Coronavirus, everybody's wanting to know, well, what do you think about things, and is there some testing that's coming out? I am excited for the antibody testing I'm just hoping that the test is legit. So I'm aware of a couple different tests available. One is got some conditional use approval through the FDA on Emergency Use Act about saliva. I'm most excited about that one from all the research that I've read. The concerns that I have with antibodies, at least the journals that I've been reading about that, is that there's a coronavirus that causes the common cold. There's also COVID-19 coronavirus that it can cause some really serious death problems, and obviously we're in the middle of that. And is the antibody testing against corona, COVID-19, or corona with a cold? And so I think that's one of the reservations that I have about the current antibody testing. Is it legit antibody testing? Is it something that we can trust? Because the frustration about the coronavirus is the misinformation and like who can you trust? You read some stuff and it's like, oh my gosh, it's going to be like worldwide Z, like everybody's going to die. And then you read stuff saying, oh my gosh, it's not that significant. And we say not that significant. In my area of the country, it hasn't been in my local community and stuff like that. And then I'm aware of people that are tragically passing away. So you have this huge spectrum of, and I just wish we had a little bit more consistent information that we could trust and go over. And so that's kind of the update on the coronavirus. Last week, people were talking about COVID toes. And so we've had an additional week about that. COVID toes are the skin afflictions and problems that come with the coronavirus, where you get skin breaks out on the feet, and sometimes it's in the hands. It's getting to be more and more of basically one of the clinical symptoms of the coronavirus, although a lot of things can cause the COVID toes. The other things that people are asking about, well, what are you doing to be healthy? Well, one of the most exciting things that I'm talking about is the ultraviolet blood irradiation therapy, UVBI therapy, that was developed in Germany in the 1940s. It's written about in one of my favorite journal articles, The Cure That Time Forgot. President Trump has been saying, what about ultraviolet therapy? Heck, we know how to do that. Like, you start an IV, you pull out a unit of blood, you put it into a saline bag with a little bit of heparin so it doesn't clot, and you run it past an ultraviolet chamber back into the body. It's fantastic for inflammation. We've been using it for chronic infections like Epstein-Barr and staph and MRSA infections. We've had some really good outcomes when IV antibiotics and hyperbaric oxygen haven't worked. The ultraviolet therapy, and you can see that story up on our website. One of my patients and friends, Brent, we had a really good outcome with that, where we saved a foot from amputation, and that's something that we routinely treated with ultraviolet therapy. And so that's something that we do in the office. It's a trick taught to me by Dr. Rowan. A shout out to him for all the literature that he's been putting out about that. Mary Jo Harris. Hey, Mary Jo. Dr. J, I need to get my blood pressure under control. I'm on 3 medicines that I'd like to get off, but even on the meds, my numbers are all over the place. So a couple things, Mary Jo, that I would be inclined to try is, number one, I keep going back to this because it fixes everything. Vitamin D, I really like to be 10 to 20,000 units. Magnesium, about 600 milligrams. A lot of times, magnesium pills will come either in 100 milligrams or 200 milligram dosages. 2 to 3 pills breakfast, lunch, and dinner will get you around 600 milligrams. Magnesium gets blood pressure to relax, get the blood vessels to relax. Another really good trick is lipotrophic B vitamins. So those are the fat-loving B vitamins that help to treat the nerves on top of the blood vessels. They get them to relax. I've had really good outcomes with that for coronary tense patients. And there's a homeopathic called Rauwolfia. An IV treatment is magnesium and B6. But Mary, please reach out to me and let's get you on some things that will support your blood pressure meds. And I just want to review with you vitamin D, 600 milligrams of magnesium, lipotropic B vitamins. There's another one called, there's a Mintran formula that I've seen good outcomes with. And we got to take the stress out of the system. Something's really pushing your system and the vessels are constricting and it's making the blood pressure go up. And blood pressure is the silent killer. We want to help get that under control. And maybe there is some things that we can do to help with the blood pressure medications. Maybe there's something that we can do to help with the physiology to get everything to relax. It's so nice to hear from you, Mary Jo. I want to say hi there. Okay, another question that we've been having is on something called trigger finger. Now, trigger finger is what happens when you go to bend your finger. They don't move, all of a sudden it snaps like that. And a lot of the medical treatments, hey, let's do cortisone injections. My dad taught me a really neat trick. My dad practiced for 52 years. He passed away 8 or 9 years ago. And he was a wealth of information. And he said to me that trigger finger is usually associated with a vitamin and a mineral deficiency. The vitamin deficiency is vitamin E, a natural source. I like to try people about 400 to 800 international units of vitamin E, and then also selenium. And there's a really neat homeopathic gel called Tea Relief that I have pretty good outcomes with. But orally get on vitamin E, get on some selenium, and then get on some Tea Relief. I've seen some really good outcomes with that. Norma Marina. Hi, Norma. It says, is rheumatoid arthritis caused by leaky gut? And the answer is your gut enormously influences inflammatory arthritis, like rheumatoid arthritis. I think the rheumatoid arthritis is caused by a couple different things. Let's just go through those. The first one is that it can be inflammatory because of what's happening in your stomach. And yes, I believe that, and I encourage people, hey, let's just do a really healthy and safe removal of bad inflammatory foods out of your system. Eat like a caveman for a time period. I like to encourage people to try to do it for 90 days. So for 90 days, we want to have fruits, nuts, vegetables, meats, and just try that. Avoid grains, carbohydrates, and sugar. You know, people say all the time, hey, Dr. West, I've been tested for celiac disease and I don't have it. And my response is, look, just try it. It doesn't cost you anything to do this. It's hard to do, but so many times people with rheumatoid arthritis, you get them off dairy and you get them off grains, and their inflammation goes down, and then you can put a protocol together to help try and rebuild the joint. And you never take a RA joint and make it completely normal, but there's a lot of fire that you can get out of the joint. Now, how is treatments continual for out-of-state patients after evaluation? That's the second part of Norma's question. And the answer is this. We want to do virtual help and make it so that you need the office the least amount as possible. When you come to the office, we do an evaluation. I like to get people to 1 million milligrams of vitamin C in an IV protocol for rheumatoid arthritis or MS, Sjogren's disease, or ankylosing spondylitis, because it's not an overactive immune system. It's an immune system that isn't working right. And we have so many times people will come in and I'll put them on an immune protocol to help reduce the inflammation and to get rid of infection, because you'll see so many times people with rheumatoid arthritis, they have something underlying that's occurring. They have a bacteria, there's a virus, there's Lyme disease, there's a chronic yeast problem. Like there's something in the system and it's eating the joints. The body is trying to get rid of it. It sends in inflammatory cells to get rid of it. You start this little war that's in the joint. And if you give the body enough horsepower, what happens is you can get rid of you can make the RA factors normal. Now, I've had people say, my doctor says that isn't possible. We've had it happen a whole bunch of times. Let me just get you over again to our patient testimonial website. I think it's on, well, there's two of them right here. Number one is over here on the left, or excuse me, on the right. This is Larry. Larry beat sarcoidosis, which is an autoimmune disorder, severe joint pain. He even had some lymphatic cancer going on. Then right next to him is Casey. You know, Casey came in. This is an awesome story. I'm really fond of Casey and his dad, Wade. He came in with the diagnosis of an autoimmune disorder. You can see the video. And what happened is we put building blocks into the system. It's not fair to say that it's completely gone. It's just way better. Casey's doing all the stuff that he should be doing. It's just kind of fun. I've got some really good testimonials on rheumatoid arthritis on here. Okay, actually right here, down in the corner, Gay came into the office with an elevated RA count. Most people are uncomfortable when it's in the hundreds. Hers was over 2,000. One of my very favorite people. Unfortunately, Gay passed away in an accident a couple years ago. But one of my dearest friends, she had rheumatoid arthritis, started taking care of her in 2005. And before she passed away, her RA counts were literally normal. So that being said, Beverly Hodges, I have extensor tendon partial tear. Is this something that you can heal without surgery? Maybe. So the answer to that is it just depends on so many factors. I would need to know the mechanisms of the injury, and also what your options are. What have you tried? Sometimes you can do that. The other questions that I have up here is, let's see, just going through. Norma, we talked to. Beverly Hodges here. Is the possible causes of acne? Wow, what a great question. So here's some ideas about acne. First of all, your skin is the biggest organ in the body. When we overload our liver and our kidneys, the body tries to recruit the biggest organ in the body, the skin, to help detoxify and push stuff out. It's my opinion that acne is an external manifestation of an internal problem. So some things that really help with that. One of my favorite things to do for acne is a blood purifying agent called chlorophyll. It comes from plant blood extract. So spinach, kale, it's literally like tree sap. It's like syrup that doesn't have any sugar to it, and it's a blood purifier. It helps tremendously with acne conditions. The other thing is to do a food elimination diet. There's a great book on Amazon I would encourage you, if you're concerned with acne, is called Breaking the Vicious Cycle, and it's how to get your GI system to get back and work normally. Amazing book. There's a lot of treatment options for acne, balancing hormones, recognizing where you are in basically the hormone cycle, teenagers or PCOS. I've seen a lot of acne with that, and getting the body healthy. My first step: fat-soluble chlorophyll, food elimination diet, and let's see with it. Now, some treatment considerations for acne. One of my favorites is to do something called minor autohemotherapy. It's something that I was taught by Dr. Bruce Shelton, where you take a little bit of blood out of your body, you mix it with a homeopathic, and you can inject it into the muscle. Now, when you pull it out of the vascular system and you put it into the muscle system, a lot of the antigens and irritants and stuff like that the body has in the vascular system, it gets used to what it does when you put it in the muscle system. The body's like, oh my gosh, it's not supposed to be here, and that does a self-cleansing mechanism. It's talked extensively in a book called The Manual of Neural Therapy. It's an age-old German technique. I've seen some really good outcomes. It's basically taking your body fluids and treating yourself with it. It's really simple and easy to do. I've been doing it for decades in the office and the system, and some really good outcomes. Also, a question is, it says, hey, Dr. West, stop being silly and quit reading the list. We'll put it on the live feed so that you can see the questions. It's so hard to find good help these days. I mean, geez, like when you think you're being efficient, your team tells you, hey, stop doing that. So another questions that we have from Jose, I guess we're going to keep him on here. Okay, it says here, last week we talked about digestion and how important it is for your body health. As a reminder, we have a little digestive program that we put together that works on the top part and the middle part and the end of your stomach. It's a way to help digest food, how to help with your liver and your bile storage. If you don't have a gallbladder, it's really important for your liver to be working optimally so you can break down and emulsify fats. And then for people that are having problems in the last part of their colon system, which is where you absorb your water and your nutrients, I put together a program where you can do that. If you'll just hashtag GI in the comments, you can reach out and I can help you with a stomach protocol. You are what you eat, and you are what you're absorbing. So with that being said, we are going to move to an earlier time on our Facebook and YouTube lives. We finally got our technology dialed in, and I've been giving Jose a lot of grief, but one of the people on our team that's helping us, Jose, has been really working hard on getting it to stream, and oh my gosh, we finally got it done. It only took us, a month to put that together. It was challenging, and a big shout out to Jose. And then Becky's over here saying, hey, this is what we can do to help people. Let's put some GI packs together and some other things. Also, a quick update. We talked about how viruses they can't handle oxidation. One of my heroes and mentors, Dr. Rowan, saying, hey, the coronavirus and other viruses should be relatively easy to handle because they can't handle oxidative damage. So we put together an ozone program, and then what happened is everybody else wanted ozone units. So we are back ordered. They're coming. Please be patient. It's the best investment that you can do to have stuff at home because it's just the best way to get oxygen into the body. You can put it in the ears. You can drink it. You can also do an ozone enema. And I'm excited for people that have got the units. They're coming. I'm sorry that we've had a delay in some of those units. The other thing that someone was asking me about is what should I be eating during the shelter at home place? And I tell them, please eat as healthy as possible. Only eat foods that spoil. Just eat them before they spoil. And so people are like, well, wait a minute. Like, should I be eating like rotten food? No. Don't do that. You eat the foods before they spoil. But if there's licorice or Twinkies or hard candies and stuff in your house, guess what? Bugs aren't eating them because they're not really real food. You shouldn't be eating them either. So, and then the thing that I tell people all the time, one of the most underutilized things that you can do for pain, for headaches, for stomach problems, for hormone imbalances is water. Like, I just really want people to concentrate on getting enough water into your system. People say, how much should I be drinking? And the answer is a lot. Well, what does that mean? Well, I guess the rule of thumb is half your body weight in ounces. But another thing is just drink a lot of water. And when people say, well, I don't like the taste of water, then my response is, well, then try and make it so that you can get liquid in your system somehow. Put a lemon in it, put a strawberry in it. If you have to have a little bit of flavored water, do that. When people say, can I get enough water from fruit juice? The answer is no, you cannot do that. And here's why. If you want to eat an apple, I'm all for it. You want to eat an orange? No problem. When we take all of the nutrients and fiber out of the orange and then do juice, it's like you're getting all of the good things without the pulp, except it's too many good things. So too much of a good thing is not healthy for you either. So be careful with fruit juices, water, and avoid any acid. I think acid's really bad for your health. And people say, I don't drink acid. I'm like, well, do you have soda? Oh yeah, I have 24, 60 ounces, 44 ounces. Like, that's acid. That's what gives it its fizz. So no one wants a lecture in the principal's office or in front of your, ecclesiastical leader. So I'll stop with that. I just want to remind people to get water. So with that being said, a quick wrap up. Number one is get water, healthy and alive foods, some green, some yellow, some orange and stuff on your plate. That's really healthy for you. That's number one. Number two is eat foods that spoil. Just eat them before they spoil. If you're having any stomach problems, please be aware that there's a GI pack we put together. Hashtag GI in the comments. My team will reach out to you. A couple patients that have asked questions. Remember, we're switching everything Thursdays till 5 o'clock for a question and answer period. Some of the people are saying it's just too late to participate. We're reaching out to our audience. We want to help as many people as possible. And then the coronavirus update is, wow, I'm so excited for life to get back to normal. Now, I'm not sure exactly when that's going to be. I don't have a really good crystal ball other than I can say, let's get it, hopefully get herd immunity. Let's get out. Hopefully it'll get away from the sun and some other things that are positive factors for the pandemic. And then to keep your body healthy, I've said this for a couple weeks now, vitamin C, vitamin D, vitamin A, and zinc. 10,000 units of vitamin D is what I'm recommending for me and my family. 10,000 vitamin A, 3,000 milligrams of C, 30 milligrams of zinc. I think that's a really good outcome. Be active and get motion in your system. Oxygen's really important. Matter of fact, my friend Dr. Rowan's saying that the viruses can't handle oxidative stress, so let's get oxygen in the system. One way is movement and activity. There's ozone considerations. There's any possibility of using saunas and stuff like that. I think those are good overall things for your health. And I think that those are really help to basically give you some alone time for meditation, thinking, talking to yourself and stuff. I think those are good for overall health. I recognize that it's not anything approved by, for the COVID-19 or anything like that. I just think that there's some good basic rules to follow. So that being said, a shout out to the West Clinic family and patients and friends, everybody associated with our Facebook and YouTube Live. This is Dr. West. I will see you next week, Thursday, 5 o'clock Mountain Standard Time. question and answer period. I'm going to put everything out on an email. Please answer questions. We're going to do a supplement giveaway for questions. And so we have a couple trivia questions that we're going to do. Number one is we want to know how many years Dr. Nelson has been in practice. So Dr. Nelson is one of our secret weapons inside our office. He's part of our team. That's part A. Part two is how many years has Shelby been in practice. So Shelby's our medical director, phenomenal healer, and so those are the trivia questions. When we go live next Thursday at 5 o'clock, you answer those, you'll be eligible for a supplement giveaway. We're giving away some liposomal vitamin C, and we're giving my favorite thing to recommend for people, and that's brain function. I can handle gray hair. I can handle wrinkles. My brain doesn't work. Bad things are going to happen. Liposomal C and Dr. J's favorite brain supplement for 2 trivia questions. So here's what you need to do to be eligible for the supplement giveaway. How many years has Dr. Nelson been in practice? How many years has Shelby been in practice? And you have to ask a healthcare question. I'll see you guys next week, Thursday, 5 o'clock Mountain Standard Time, West Clinic question answer period, 5 o'clock. See you guys later.